Hello friends, today we'll be discussing about thread lift procedure, and thread lift procedure, as you know, is done by the insertion of threads below the skin level, and therefore these threads will catch up the underlying layers and therefore pull up the facial skin with the underlying structure and therefore correcting the aging changes in the face. So it is a non-surgical procedure that is without the use of any cut. The threads that are commonly used nowadays are either PDO threads or PCL PLL threads. Now PDO thread is around 1.5 to 2 years duration wise lasting, and PCL PLL threads last more than 2 years. And the type of threads, the cross section configuration of the threads, you can find different types. Mainly we use the barbs one or cogwheel ones. You have to understand what the thread does. What we are doing in thread lift is we are trying to mimic the effect of facelift by the use of thread without any cut. Now facelift is the gold standard procedure for anti-aging, where overall the mask layer, skin layer, everything is addressed, and therefore anti-aging changes that the patient achieve is quite well maintained, and we get a significant reduction in the age after the procedure. Now somebody who is slightly young, who is not yet in the age group where the facelift is required, or the aging changes has not developed very severe, or somebody who is unable to undergo a surgical procedure because of other problem that she might be having in the body, mainly the problem that are contraindicated for anesthesia. So in this kind of scenario, we do thread lift to just get a anti-aging effect, which is not better than facelift, but at least it gives a little improvement in the facial appearance. Now what we are doing in thread lifts, now I am having a PCL PLL thread. The company is Aphrodite. There are other threads also available in the market. Radius, the Aptos, different kinds of configuration, different kind of thread material that they are used. Every surgeon or esthetician has their own liking towards a thread depending on the uses that they have been doing over the years. Now the basic difference that we'll have is mainly the thickness of the thread, the cross section of the thread, and of the material of the threads. Now this thread is hooked onto a needle, which is, the tip is blunt, and this needle is inserted below the skin and at the subcutaneous level, and then the thread goes on till the point where we want to reverse the change. Like in the case of face, we are trying to address the nasolabial fold and the labiomental fold, the jowls. So these are the two main aging changes that the patient wants to get reversed. Now what we do in such scenario, we insert the thread from just anterior to the root of the helix behind the sideburn. Now this thread is passed on to the upper part of the nasolabial fold. Two threads are passed on the upper part of the face, and the two threads are passed in the lower part of the face. These two threads therefore pulls up the skin, restoring the aging changes that has happened, mainly the nasolabial fold and the labiomental fold, the jowls. Now once this threads is passed on the subcutaneous layer, the needle is gradually pulled out, and from the tip of the needle there's an opening where the thread is attached to the skin and the SMAS layer below. Now the thread has a lot of barbs, so these barbs hold on to the SMAS layer. The barbs are 360. Now it's not unidirectional barb. The barbs is existing all around the thread. So the threads goes inside. It attaches the adjacent structures, mainly the structure below that is a SMAS layer. The structure above is a subcutaneous layer. Now it holds on to those, and therefore once we pull out the needle, the thread is automatically getting released. Now as the thread is getting, we are also simultaneously pulling the threads, and therefore there is a bursting effect that's happening at the SMAS layer and the subcutaneous layer. So the whole skin is gradually pulled up due to bursting effect in the underlying structure, and therefore we are able to achieve a pull of around more than 1.5 to 2 centimeter at times, and therefore restoring the aging changes in the face. Once the thread is pulled out, we do a little maneuver to fix it at this junction at the point of insertion, and then the thread is cut and the skin automatically covers up the small little hole from where the needle was inserted. What you see after thread lift is a little bit of puckering here and there on the line of the threads, or you can have a little asymmetry of the face to start with, and also sometimes you will have swelling and bruising. So these are the common problems that we see after a thread lift procedure, and these problems generally settle down in 2 to 3 weeks time. During this period you might feel a little uncomfortable in terms of going out, meeting friends, because the asymmetry sometimes can trouble you. But After 2 to 3 weeks, it's almost settles and you get the pulled up anti-aging effect of the threads, and this effect will continue for at least 1.5 to 2 years, and sometimes we see the effect even lasting up to 2.5 years. So this is a long-lasting procedure, not as good as facelift, but you have to understand that this downtime is less, cut is not there, so it is a very good alternative for a facelift procedure who doesn't want to go under the knife.
50-year-old lady. Now what we see is a mid-facial skin sagging, mid and lower. So these are the jowls, these are the nasolabial fold. As you can see, the cheek mount has fallen a bit. Now we are planning to do a thread lift, and thread lift will just pull up the skin like this, the vector upward and laterally. So that will give a rejuvenated anti-aging look, and that will at least reduce the age of seeing by 5 to 10 years. Later on, we'll also try to do a lateral eyebrow lift that will complete the anti-aging procedure. The face, she had already gone the upper eyelid and lower eyelid, so that's taken care of. We are just focusing on the facelift by threads because her laxity is not so much that we need a traditional facelift. Generally, had it been too severe like this, where thread will not work as much as desired, then we would have gone for a facelift. Now this can be easily tackled with a thread lift procedure.
Keep watching our videos. We'll come up with more informative videos. Do share with your friends and share your opinion, views about this video. Also, if you have any queries, you can write it down. We'll be glad to reply you back. at the earliest. Thank you so much and have a good day.